Polypharmacy, seniors taking 5 or more prescriptions each day, has become a common reality for older adults. But what if fasting, when done safely and with medical guidance, could help bring that number down? Clinicians like Dr. Alan Goldhamer report strong results in supervised settings, showing that seniors who follow structured fasting protocols often see improvements in blood sugar, reductions in metabolic decline, and a reduced need for daily medication. The goal isn't only to add years to life, it's to improve the quality of those years. Later, I'll share a practical starting plan and the key safety checks every senior should discuss with their doctor. And since today's seniors are managing more prescriptions than any generation before them, it raises an important question about whether all of those drugs are truly necessary. Why fasting matters for seniors in 2025. In 2025, the conversation around health for older adults is shifting in a very specific way toward the question of fasting. For decades, seniors have been told that the key to long-term health is tightly managed medication schedules. But now, more researchers and clinicians are drawing attention to fasting as a practice that may reduce dependence on drugs and target the very issues that cause chronic disease in the first place. What makes fasting matter so much to seniors right now is not that it's new, but that its benefits appear to strike at the challenges aging adults face most directly: high blood pressure, insulin resistance, low energy, and the gradual accumulation of pills that rarely solve those core problems. Much of the hesitation around fasting for seniors comes from the belief that it's unsafe in older age. The concern makes sense. Many older adults naturally lose muscle mass and sometimes struggle with weight loss already. On the surface, withholding food might sound like adding fuel to the fire, but clinical work has increasingly challenged that assumption. Under supervision, fasting can support older adults by reducing the very symptoms they are medicated for in the first place. Blood pressure, glucose management, inflammatory markers, and even early signs of cognitive decline all show measurable improvement during structured fasting programs. Seniors in these settings are not wasting away, they're experiencing changes that make daily functioning easier. Importantly, fasting isn't simply another way to count calories. When you stop eating for set periods, the body shifts into a restorative mode that constant eating never allows. Repair pathways like autophagy switch on, damaged proteins are broken down and recycled, and the body shifts toward using fat as a primary energy source. This combination reduces inflammation, improves metabolic control, and resets hormone rhythms tied to energy and sleep. For an older adult, it means more than cutting energy intake. It signals a fundamental recalibration of how the body runs. A practical example makes this clearer. Imagine someone who has struggled with elevated blood pressure for years. Medication adjustments gradually increase. Side effects build over time, yet the root issue stays in place. When this same individual undertakes a carefully supervised fast, the response is often striking. Blood pressure can fall significantly within days, and for some patients it stays at safer levels long after refeeding begins. In certain cases, medication doses have been lowered or discontinued altogether. To be clear, results differ from person to person, and they depend on the fasting duration, medical oversight, and the individual's overall health. But the potential for rapid improvement is real and documented. This is also where the limitations come into play. Clinical reviews consistently point out that while fasting demonstrates powerful benefits in markers like blood pressure, insulin sensitivity, and chronic inflammation, large randomized studies in people over 65 remain limited. Older adults bring unique risks, comorbidities, variable nutritional status, and differing medication burdens that require careful consideration. This means fasting should be approached not as a blanket prescription, but as a tool that needs medical guidance and individualized planning. Even with those caveats, the consistent observation is that when it's done properly, older adults can experience meaningful health improvements that lighten their pill load rather than add to it. And those improvements aren't vague. The most widely reported results in supervised fasting settings include lower blood pressure, improved insulin sensitivity, and measurable drops in systemic inflammation. For many seniors, these shifts translate into reduced fatigue, steadier daily energy, and less dependence on drugs with irritating side effects. In other words, fasting produces the very health changes that daily prescriptions aim for, but by addressing the core dysfunction instead of masking its outcomes. This distinction between management and reversal is essential. The majority of common prescriptions are designed for control rather than lasting correction. Blood sugar can be lowered by medication, but the cellular resistance to insulin remains. Cholesterol can be reduced with a pill, but the metabolic processes behind it remain uncorrected. Fasting actually prompts the body to recalibrate those processes, lowering stored glucose, reducing pro-inflammatory load, easing burden on the kidneys and liver, and supporting healthier cardiovascular function. For someone who has spent years feeling stuck inside a cycle of measurement and dosage, that shift from controlled numbers to underlying repair can be life-changing. Adding to this perspective is the understanding that not every health condition of older age is inevitable. Issues like hypertension, type 2 diabetes, and chronic inflammation are not simply the result of birthdays. They develop after long-term metabolic imbalance combined with environmental and lifestyle pressures, which means interventions that recalibrate metabolism, like fasting, can improve or even reverse them. For seniors, this is not about avoiding aging altogether, but about separating what is truly age-related from what is accumulated dysfunction. That difference is crucial, and fasting directly addresses it. Of course, skepticism remains. Many assume seniors are too fragile to engage in fasting safely. But clinicians experienced with older populations counter this by showing the opposite under appropriate guidance. What proves more damaging for older adults is not the fasting itself, but the years of multi-drug use, polypharmacy, that place immense cumulative strain on the liver, kidneys, and digestive systems. To borrow a mechanical analogy, fasting doesn't starve the engine of fuel. It clears the sludge and allows the parts to function properly without constant chemical manipulation. On a very practical level, this has substantial implications. A single additional prescription often cascades into side effects that require yet another medication. What begins as treatment for elevated blood pressure unfolds into a sequence of dependencies that burdens daily life. Fatigue, dizziness, electrolyte loss, and sleep disruptions layer over each other until the drug regimen begins to feel heavier than the conditions themselves. Fasting, by reducing the need for some of those initial prescriptions, interrupts that cascade before it becomes unmanageable. It's worth remembering that fasting is not some breakthrough discovery of the modern world. Humans have practiced it for centuries, whether deliberately for health or simply because food was not always available. What's new is the modern lifestyle, which eliminates natural gaps in eating and piles medications on top of the body's load. Seniors today are living in an environment of near constant consumption and pharmacological support. Fasting reintroduces a habit that biology already recognizes, giving systems the time and space to restore balance rather than endlessly compensating. And this is why fasting holds such unique relevance for seniors in 2025. More than ever, life expectancy has expanded, while the years lived in compromised health have also stretched longer. The real opportunity is not simply extending lifespan, but reducing the burden of chronic conditions that imprison people in cycles of treatment. For older adults, fasting represents a grounded, practical method of not only slowing decline, but in some cases reversing it. Understanding this puts the next issue into sharper context. Around the world, seniors are not just contending with chronic illness, they're managing entire stacks of daily prescriptions, often multiple times a day. It's here, in the growing complexity of those routines, that the true weight of modern aging becomes most visible: the prescription pile problem. Many older adults today face what doctors call the prescription pile problem. Polypharmacy, taking 5 or more medications at a time, has become common among seniors. For many, daily life is organized around pill boxes divided by the hour, with drugs for blood pressure, cholesterol, sleep, digestion, blood sugar, and pain all lined up. It looks like careful management on the surface, but the reality is that these stacks of pills often create as many difficulties as they try to prevent. The problem isn't just the quantity. It's how one drug leads to another. A blood pressure medication can cause dizziness. That dizziness increases fall risk, which may require pain medication after an injury. Pain medication, in turn, can cause constipation, sparking the addition of a laxative. A treatment designed to help the heart ends up reshaping life in ways that no one planned. This isn't an unusual story. It's the pattern at the center of polypharmacy. Research shows that polypharmacy doesn't just create inconvenience, it heightens risk. Older adults are more vulnerable to drug interactions because their liver and kidney function often decline with age. Medications that would be tolerable for a 40-year-old can accumulate in the system of someone in their 70s, intensifying side effects and making standard doses too strong. The result is sometimes extreme fatigue, confusion, or even dangerous medical events. In fact, polypharmacy increases the likelihood of adverse drug reactions and hospitalizations, with many seniors ending up in emergency rooms not because of their original condition, but because of medication conflicts. On a day-to-day level, this takes a heavy toll. Instead of feeling energized, many older adults live in a fog of side effects. Fatigue, digestive discomfort, weight changes, and mental cloudiness become accepted as normal aging when they might actually be consequences of drug combinations. And because specialists often prescribe medications without full visibility into the others a patient uses, even well-meaning decisions can create complicated overlaps. What looks like healthcare progress can quietly become a cycle of managing medication side effects rather than treating disease itself. For a lot of seniors, the pill organizer symbolizes this burden. The brightly colored compartments, meant to bring order, serve as a reminder of just how many moving parts there are to get through a single day. And, unlike misplacing a set of keys or a grandchild's phone, missing or doubling up on a pill can have a serious impact. Mistakes happen often, especially when prescriptions multiply faster than anyone can fully keep track. This is why the prescription pile weighs so heavily, not just physically but mentally. Living with multiple medications can make someone feel less like a person and more like a patient defined by conditions to be managed. Each new prescription signals another layer of dependency. And while some drugs are essential and life-saving, it's clear the system often defaults to adding rather than asking whether there might be a way to subtract. That's where fasting offers a different pathway. Instead of addressing symptoms with yet another pill, fasting works on the deeper processes that made those symptoms emerge. Blood pressure, for example, has been shown in supervised fasting programs to decrease significantly, reducing or eliminating the need for medication. Blood sugar regulation often improves, meaning some patients with type 2 diabetes require less support from drugs. And when inflammation lowers, pain tends to ease, which can lower reliance on painkillers and all the secondary medications they necessitate. The difference is this: rather than patching problems one at a time, fasting shifts the entire baseline of health. It is not an overnight cure, and it is not safe for everyone without oversight, but the documented results show that for many older adults, medication lists do shrink. The domino effect begins to reverse. Fewer prescriptions leading to fewer side effects, leading to fewer follow-up medications. It's important to recognize balance here. No responsible physician would suggest that every drug can or should be thrown away. Some conditions absolutely require long-term pharmaceutical support. But by easing the metabolic dysfunction that drives so many prescriptions, fasting creates opportunities to reduce dependency. A senior moving from 8 or 9 daily pills down to 3 or 4 isn't just experiencing a smaller regimen, it's regaining a sense of freedom. This freedom extends beyond the body. There's a psychological lift in no longer feeling tethered to medication schedules that divide the day into strict intervals. That shift restores dignity and builds confidence. People see themselves less as patients and more as full participants in daily life. They move through days with more energy, fewer restrictions, and without the looming worry of managing side effects from a complex mix of prescriptions. The benefits ripple outward to families and the healthcare system as well. Fewer prescriptions often mean fewer emergency room visits, fewer hospital stays due to drug interactions, and decreased financial strain from extensive pharmacy bills. Families worry less about whether mom or dad is keeping the schedule exactly right, and seniors themselves can focus less on medical logistics and more on meaningful activities. Taken together, this picture is clear. The prescription pile is not an inevitable part of aging. It reflects a default to management by addition, layering drug upon drug in the hope of control. Fasting approaches it differently by addressing the metabolic roots of disease and restoring stability without adding to the chemical load. Later in this video, we'll go into exactly how seniors can approach fasting in a way that reduces medication needs safely, along with the precautions required to prevent risky interactions. For now, the key point is this: the cycle of adding prescription after prescription isn't the only option, and there is a way forward that doesn't depend on constant pharmaceutical expansion. And that brings us directly to the next misconception many seniors have lived with for a lifetime: the idea that you must never skip a meal or you'll get weak. Fasting versus eating regularly myth. For decades, nutrition advice emphasized steady eating patterns, but one of the most persistent messages was the belief that eating regularly prevents weakness. Older adults in particular were cautioned that skipping meals might leave them vulnerable to sudden drops in energy or blood sugar. The assumption was that frequent eating was the safest way to stay fueled, but research now paints a more nuanced picture. For many people, short fasting windows do not cause weakness. Metabolism is equipped to shift from glucose to stored fat and ketones, which can provide steady energy. At the same time, it's important to acknowledge that those on medications affecting blood sugar or blood pressure need medical supervision before making changes to eating patterns. Understanding how this works begins with energy storage. Normally, the body uses glucose from food as its main fuel. When meals are spaced out, the body transitions, first drawing on glycogen in the liver and muscles, then shifting toward producing ketones from fat stores. This change usually occurs somewhere in the 12 to 24-hour range, though the timing varies. Ketones are a reliable alternate energy source and are frequently described as supporting clearer thinking and more stable physical energy. In this way, fasting often feels less like deprivation and more like switching power modes. Why does this matter so much for seniors? As the body ages, processing sugar and starches often becomes less efficient. Frequent eating can extend blood sugar spikes throughout the day, pushing the pancreas to release insulin repeatedly. Over time, this can create or worsen insulin resistance, which leaves people feeling sluggish after meals and more fatigued overall. Brief fasting intervals interrupt this pattern. By reducing the number of daily spikes, insulin levels can stabilize, and cells may gradually respond to insulin more effectively again. Many older adults describe experiencing steadier energy once they establish a consistent fasting routine. One easy comparison is the hybrid car. When one fuel source runs low, the system transitions seamlessly to another. Human metabolism works the same way. When glycogen stores decline, fat takes on the role. This isn't evidence of starvation. It's normal physiology that developed long before the modern culture of constant snacking. The problem is that decades of eating every few hours have kept many seniors locked into one mode, leaving their bodies out of practice at switching fuels. Fasting reintroduces that capacity, allowing people to discover that they can go longer without food than they may have thought possible, often with less fatigue, not more. Critics sometimes argue that fasting places older adults at risk of losing muscle. Here again, the details matter. Short fasts and intermittent fasting schedules generally preserve lean mass when paired with adequate protein intake and light resistance activity. In fact, the hormonal shifts during fasting often support tissue maintenance. What really protects seniors' strength is consistent protein in meals and simple strength work like resistance bands, walking with light weights, or chair exercises. The point is not that fasting eliminates all concern about muscle, but that with a balanced approach, it can work alongside practices that support lean tissue rather than erode it. For those who try fasting under safe conditions, the reported effects are often the opposite of weakness. Blood sugar steadies between meals, digestion gets a break, and energy doesn't dip as sharply after eating. Some seniors even report fewer issues with bloating or heartburn because long pauses between meals reduce gut strain. That sensation of balance, steady rather than spiking, is the outcome people often find most surprising. Instead of feeling frail between meals, many feel noticeably more resilient. The role of ketones is especially important here. They not only provide fuel, but they do so in a way that often benefits the brain. Unlike the swings of glucose highs and lows, ketones deliver a more consistent energy flow. This is one reason some people describe improved clarity or focus during fasting windows. It isn't a universal effect, but for many, this gradual shift away from sugar-dependent swings is what allows the body to feel stable even without food intake every few hours. So why did the constant eating message last so long? Much of it is cultural habit, reinforced over decades. The food industry's promotion of snacks as essential certainly played its part, and early medical advice sometimes blurred together the experience of diabetics on glucose-lowering drugs with that of otherwise healthy people. What endured was a message that missing a meal was inherently harmful, when in many cases it was only those with very specific medical conditions or medication routines who faced such risks. For healthy adults, the evidence does not support the idea that 3 large meals plus constant snacking is the only path to stable energy. At the same time, seniors considering fasting do need individualized guidance. People with diabetes, especially those taking insulin or medications that lower blood sugar, are at risk of hypoglycemia if their medication isn't adjusted. Likewise, those on blood pressure drugs could experience dizziness if blood pressure drops during fasting. This is why every major medical institution stresses that older adults should discuss fasting with their clinician before beginning. The right structure, length of fasts, frequency, and medication balance can make the difference between experiencing benefits and encountering preventable problems. When applied properly, fasting provides older adults with a way to access their stored energy instead of being dependent on constant refueling. That changes how they experience daily life. Activities that once felt draining can feel manageable. Stretches between meals no longer bring on panic, and reliance on sugary snacks for energy fades. These adjustments don't just improve numbers on a chart, they directly shape quality of life. Seniors often describe walking more freely, thinking more clearly, and feeling lighter in their routines. And this adjustment sets up another important benefit. When energy steadies, people begin to notice how their bodies handle movement and recovery differently. Less strain on the digestive system, fewer big swings of glucose and insulin, and steadier blood flow all contribute to a body that is more comfortable to use day by day. That comfort influences mobility, endurance, and how easily seniors keep up with routines without relying on stimulants or snacks. In that sense, the real myth isn't only about weakness after skipping a meal. It's about underestimating how adaptable the body remains, even as it ages. Fasting is not about depriving the body of what it needs. It's about creating space for systems to reset, stabilize, and draw on reserves meant for exactly these intervals. For seniors willing to approach it safely, this shift can be a turning point in breaking free of the cycle of constant eating and the energy fatigue it brings. The larger question then becomes what happens beyond energy and stability, when fasting interrupts not only calorie intake, but also some of the metabolic strain of constant food processing. It introduces changes in inflammation and recovery. And it is here where the body's aches, stiffness, and slowing movements intersect with how it manages inflammation, that some of the most pressing challenges of aging begin to look different. Mobility, energy, and joint relief. Mobility, energy, and relief from joint discomfort form a large part of how older adults experience daily life. Many seniors describe the feeling of slowing down as if it's an unavoidable part of getting older, but much of that decline is fueled by chronic inflammation rather than age alone. It's not just birthdays that make knees ache or stiff backs resist movement.